Hello, everyone, and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm glad you're joining us today as we discuss stroke awareness, the signs and symptoms of stroke, and why acting quickly can save a life. Stroke is a medical emergency, and knowing what to do in those first moments can make all the difference. Today, we'll talk about how to recognize a stroke using BEFAST, why calling 911 right away is so important, and what we want every member of our community to know about stroke prevention, response, and care. We're joined today by Dr. Sana Samani, a board-certified, fellowship-trained vascular neurologist, and Alan Stillman, founder of the public health initiative Stroke Smart. Dr. Samani and Alan, welcome and thank you for joining us. Before we begin our discussion, Dr. Samani, would you tell our viewers a little bit about yourself and your specialty?
Sure. Thank you so much for having me. As you mentioned, my name is Dr. Sana Somani. I'm a vascular neurologist, which means that I specialize in caring for patients with stroke and other blood vessel related conditions of the brain. I work at MedStar Washington Hospital Center, and I'm also an assistant professor at Georgetown University School of Medicine. My work focuses on treating patients who have had strokes, preventing future strokes, and educating communities about recognizing stroke early because every minute truly matters.
Great, thank you. And Alan, could you briefly tell us a little bit about yourself and the mission of Stroke Smart?
Sure. So the goal of Stroke Smart is to teach people how to recognize the signs of a stroke, and when they see it, to immediately call 911 to know it's a medical emergency. I can come to this from a personal perspective. When I was a child, I was raised by my grandmother and mother. I lost my dad as an infant, and my grandmother had a stroke. We had no idea what was going on, and we waited 4 days before calling 911. She had a horrible outcome. There's a term called locked-in syndrome, where you can't speak or move. All you have is like your eyes to move. And she went into that state. And my mother was struggling with depression, overdosed. And I lost my two parents, my mother and grandmother, because of a stroke, went into foster home. So I just had this deep effect on it. So as an adult, I'm the CEO of QuickPoint, our design and communications firm. And I thought I could use my resources to try to create this program, which I did about 9 years ago.
Wow. Well, thank you for joining us today and being willing to share your story and educate people on such an important topic. So I thank you both for being here today to do that. Let's get into our questions. One of the strengths of MedStar Health is the way our physicians, care teams, and hospitals all work together to help patients get the care that they need quickly. So, Dr. Samani, could you talk a little bit about how our physicians work together? For example, if a patient came to a primary care physician having stroke symptoms, how would that be dealt with?
Yeah, stroke care really requires a lot of coordination. So, if someone develops sudden stroke symptoms, the most important first step is recognizing that this may be a stroke and calling 911, not waiting for an appointment. So, when EMS is called, they notify the receiving hospital so the stroke team can prepare. And at MedStar, we have a very coordinated system where emergency physicians, neurologists, radiologists, nurses, other specialists, they work all together quickly to evaluate the patient. So even if someone actually first reaches a primary care office, the key message is that stroke symptoms are an emergency. So depending on where that primary care office is, so for example, if it's just a primary care office where there are just clinics and no hospital as such, then the right process would be still to call 911 so that EMS can come over and take the patient to a hospital which has emergency services. And if you come to a primary care physician which is already inside a hospital, usually a code stroke is what's called broadly in the department. It could be overhead pages or something like that that happens. And that's the safest pathway is to activate the emergency services so the patient can get to the emergency department, get evaluated by the stroke physicians, and get the right evaluation and treatment as quickly as possible.
Yeah, thank you for explaining that. That's good to know how everything's connected and coordinated to get, how stroke care works across the system. So thank you for that. And now let's talk about what everyone should know about stroke, including how to recognize it and why every minute matters. So, Dr. Samani, what are some of the signs and symptoms of stroke? And can you talk a little bit about BFAST as well?
Yeah, so BEFAST is a very simple way to remember the warning signs. B stands for balance, which means that if you have a sudden loss of balance, dizziness, trouble walking, that's an indication. E stands for eyes, which is if you have sudden vision changes or a loss in vision of one of your eyes. F is for face. So one side of the face starts drooping. So we always ask if you have someone who could be having a stroke, ask them to smile because that's how you will know if the one side of the face is drooping. A is for arm, which means sudden weakness or numbness, especially on one side. We assess it with arm. It can also be assessed with legs, but arm is the most simple way to remember. So you can clearly ask the person who might be having stroke symptoms to raise both their arms up ahead in front of them. And if one of them starts, going down, then you know that that side is weak. S is for speech. So you can have trouble speaking, you can have slurred speech, you can have difficulty understanding the speech, and it could be all this variety of symptoms. So sometimes people just slur their speech where they're like, it's very difficult to talk. And sometimes they can be speaking things which are completely out of context. For example, I once had a patient whose family member had said she kept saying, "Keep the cat on the stove, keep the
Mm,
cat on the stove," which, it's clear language, but it doesn't make sense,
right.
right? So that's how you would know that there are some speed changes that are happening. And then T is the most important, which is time. So that's the time to call 911. The most important thing is that these symptoms usually happen very suddenly. And you just need one of these symptoms to make sure that to be concerned for a stroke, basically. So you don't need to have all these symptoms. Even one of them should be enough to prompt you and trigger that call in your head that, hey, I need to call 911 and go to the closest emergency, physician.
Yeah. Thank you for going over that. And, kind of going off of that, Alan, why is it so important to educate people around you to spot a stroke?
So first, strokes are super common. 1 in 6 of us will get one. It's a horrible disease. It's the long-term, creates long-term disability, but there is a treatment for it. But when you say that people around you, when you're having a stroke, it's very difficult to call 911. You're having a stroke, right? I mean, it's like you can't do CPR on yourself. You often can't call 911. Like you said, you may not be speaking right, your arm may not be working. So the person is gonna call 911 is an observer, a bystander, whoever sees you. So you want to educate everyone that sees you regularly to recognize stroke. Sometimes we use the term called stroke smart herd immunity. That if everyone in the herd understood it, or literacy, stroke smart herd literacy, we could all protect each other by looking out for each other.
Yeah. And you touched on this a little bit earlier, but stroke is very personal to you. Can you tell us about your experience again, or, go a little bit more into detail and why it's so important to you?
Well, sure. I was 12 years old. It was a Monday, and my grandmother wasn't moving properly and she wasn't speaking properly. She was just laying in bed, and it was weird. Like we had no idea what it was. And my mother thought maybe she needed coffee. This is like thinking in the 1970s. She literally tried to put black coffee down her throat, which probably was making her gasp and choke because she was that. And there was just coffee all over her face. It was horrible. Like I said, my mother's struggle with depression was kind of in denial because I kept saying to my mother, shouldn't we call an ambulance? No one just sits there not moving properly. And it went 4 days till that Thursday, literally 4 days. She's soaked with coffee, smells. It's like a horrible scene to imagine. And of course, they took her away. And like I said, she became locked in. She couldn't do anything other than move her eyes. And then, my mother overdosed. And what really struck me is that, I went to visit her and I saw this person who was alive, but couldn't move or speak. And I didn't understand that she was still in there, right? She still had her awareness, but all she could do is move her eyes. So to my 12, 13-year-old brain, I thought she was kind of like, to use the term a vegetable, which probably not a PC term now. Um, but that was my thinking then. And as an adult, I learned what the truth was. And I just thought to myself, imagine you can't move, you can't speak, your only child is overdosed. You have one grandchild. What it would have meant if that grandchild had went there and just held your hand and said, I'm here for you. I love you. How that would have meant so much to her. But I didn't do that because I was scared and I didn't understand. And I thought, wow, if I can just try to help people avoid those kinds of horrible outcomes, it's just a good use of my life. I put about 1,000 hours a year into this for 9 years and a lot of my company's resources, because it just seems like such an important thing to save lives and the suffering, not just of the individual, but the family. I mean, I was suffering. My mother suffered. She overdosed, so important.
Yeah, it is very important. And once again, I appreciate you sharing your story and doing what you can to hopefully help that from happening to other people, prevent them, and so that they can know and know the signs if something like that happens to them. It is very important. And if stroke is so serious, why do so many people still not call 911 when it happens? Is it, you think, maybe is that lack of awareness of not really knowing what's going on, or?
It's exactly that, because most 911 things, it seems like a 911. You're in extreme pain, you're throwing up, you're bleeding, right? Like, oh my God, no doubt about it. You fall on the floor clasping your chest. No one doubts that's a 911. But stroke doesn't create pain. In fact, it creates numbness, like, oh, my arm is numb. That's weird, but it doesn't seem like a 911, right? Because people don't know that means stroke. So it's a combination of people don't know the signs of a stroke and they don't know it's a medical emergency. They call their doctor. Hey, can I get on Tuesday? My arm's numb. Maybe I slept the wrong way. Maybe a nervous pinch, right? All these stories run through their head, but not the real one.
Yeah, that was going to be my next question is, why people often call their doctor, but I get that makes sense. They're having these symptoms that they don't know are connected to a stroke, so they don't think it's a medical emergency. So it's something, I'll take care of that next week or whenever I can get in, that sort of thing. And oh, go ahead. Were you going to say something?
Here's the sad thing. The people that pick up the phones, they're not medical technicians. They're people that answer phones at doctor's
Right.
office. They
Right.
just hear somebody wanting an appointment that has something going on with their arm.
There
Like,
are,
oh,
yeah.
hey, we have an opening on Tuesday. So it's so critical to educate the people that work in physicians' offices to know the signs.
Yeah, exactly. And why should you never drive yourself or have someone drive you to the ER during a stroke?
So obviously, if you're having a stroke, imagine how poorly you could drive. There's been
Right.
numerous car accidents of people with strokes attempting to drive. So when you're likely to not only not get there, but you might kill somebody else as well. In terms of somebody else driving you, so when you call 911, they do something called a pre-stroke alert,
Mhm.
and they tell the hospital to prepare. Think of it like a pit crew in a race, right? They are just like ready. Everyone's at their station, know exactly what to do.
Yeah.
But if somebody just drives you, you go to the parking lot, take a number, fill out your insurance, it could add a half hour or an hour. So
Yeah.
you want to always call and have the ambulance get you there.
Yeah. And oh, go ahead, Dr.
Oh,
Samani.
I was just adding to that, that sometimes people think that their stroke symptoms are mild. Oh, I just feel numb. I can probably drive myself. But that's the other thing. Stroke symptoms can worsen also very suddenly. So you might be okay in one moment, but the next moment you would be unable to drive or communicate safely. So it's very important to just call EMS, call 911.
Yeah, better to be safe. And then, like we've said a couple times already through this broadcast, that time is so important. So the quicker the care can get to you rather than you driving to the care, and it makes all the difference. So I'm going to pause for a second and reintroduce, if you're just now joining us, my name is Sarah Ridenauer, and I'm here with Dr. Samani and Alan Stillman. Today we're discussing stroke awareness, how to recognize the signs and symptoms of stroke, and why immediate action is so important. If you have questions for our panel, you can leave those in the comments and we'll answer as many of them as we can during today's discussion. Getting back into our questions, to help our viewers better understand the condition itself, let's talk about what a stroke is and who it can affect. So, Dr. Samani, what exactly is a stroke in simple terms?
So, yeah, a stroke happens when there is a sudden problem with the blood supply to the brain. So, our brain is constantly dependent on blood flow because blood delivers the oxygen and nutrients that keep the brain cells working. The most common type of stroke happens when a blood clot blocks one of the arteries that supplies blood to the brain. And this is called an ischemic stroke. You can think of it like a blockage on a highway. If the blood cannot get through, the area of the brain that depends on that blood supply starts to struggle. So that's what an ischemic stroke is. The other major type of stroke is a hemorrhagic stroke, which happens when a blood vessel in the brain breaks and causes bleeding. In that situation, the blood is no longer flowing where it should be, and the bleeding itself can damage the surrounding brain tissue. So the reason reason we emphasize urgency so much is because brain cells are very sensitive to a lack of oxygen. So when blood flow is interrupted, those brain cells can become injured very quickly. The longer we wait, the greater the chance of permanent disability. But the good news is that the stroke is treatable. So we now have treatments that can restore blood flow, including medications that can dissolve clots. There are procedures where we can physically go and remove the clots. But they all work best when patients get to the hospital in a timely manner, get to the hospital quickly. And that's why recognizing the warning signs and calling 911 right away can, truly change someone's outcome who might be having a stroke.
Yeah. And we also, I know Alan mentioned this a little bit in the beginning, but Dr. Smani, how common are strokes actually? Are they rare, or I believe as Alan said, they're not so rare?
Yeah, I mean, stroke is much more common than many people realize. In fact, it is one of the leading causes of death and disability worldwide. In the US alone, nearly 800,000 people have a stroke each year. That's roughly one stroke every 40 seconds. So, in this 1 hour of Facebook Live, I don't know how many people would have had a stroke.
Yeah.
And stroke is also a leading cause of long-term disability because it can affect movement, speech, memory, vision, your independence, everything is affected. And as Alan mentioned, many people know someone who has been affected by a stroke. It can be a parent, a grandparent, a friend, or coworker. Think about it, and you will know someone who's been affected by a stroke. But as I said, it can be prevented. Many are treatable if they are recognized quickly. So we can avoid one of our family members or one of our coworkers being affected by it if we know the symptoms.
Yeah. And I think some assumption that's often made about strokes is that they can only happen to older people. Is that true, or can they affect anyone?
That's a really important question because this is a very common misconception that stroke is only an older person's disease. While it is true that the risk of stroke increases as we age, stroke can happen at any age, including in young adults and even children. So, in younger patients, we may sometimes see different causes, such as certain heart conditions, blood clotting disorders, problems with the blood vessels, trauma, or even there are many less common conditions. But many of the same risk factors we think about in older adults can also affect younger people, which includes, blood pressure, diabetes, high cholesterol, smoking, certain heart rhythm problems. So, and one thing I think we are seeing more and more is that conditions like high blood pressure and diabetes are becoming more common at younger ages. And these conditions can really quietly damage the blood vessels over time. The other important point is that stroke symptoms look the same regardless of age or sex. A sudden facial droop, arm weakness, speech difficulty, what BEFAST, like I mentioned, should never be ignored just because, hey, I'm young, I'm 20-year-old, I can't have this. Stroke does not have an age limit, so knowing the warning signs can help anyone at any age.
Yeah, that's great to know, because I think it could be easy for, like I said, it's an assumption that older people are the ones who have strokes. So if someone, my age or something is showing symptoms, it could be easy to be like, oh, it's got to be something else. I can't possibly be, old enough to be having a stroke. But so it's good to know that that's not the case. It can happen at any age. And Alan, why do so few people actually get to the hospital in time for effective treatment?
Well, because they don't call 911 at the
Yeah.
moment that happens. And they don't call 911 typically for one of a couple reasons. Either they don't recognize it as a stroke, they just think it's something else and they should take a nap, call their doctor, see if it goes away. Or sometimes they just are concerned that it's expensive to get an ambulance. Maybe I should drive myself. Which again, the cost of a lifetime of disability versus an ambulance
Right.
cost, they're a magnitude. Just to add one other note to your last question,
Yeah.
we had a 3-year-old girl who had a stroke in Virginia last December. Her
Wow.
mother was educated. At first, she's like, could that be a stroke? But she saw the little 3-year-old's arm was drooping and wasn't speaking right.
Wow.
And she got her treatment. And even at the hospital, they were like, wait, can this be a stroke? But
Yeah.
then they treated her and she's fine now. Thank
Wow.
God understood the signs of a stroke.
Yeah, wow, that's great to hear. Yeah, especially a kid that young. I would never assume it would be a stroke. And but good for her for, recognizing the symptoms. And even if she herself maybe had those doubts, if there's no possible way, like going in and getting, taking her to the hospital and getting the treatment, that's great.
Yeah.
Um,
And I also wanted to add to, you were asking why such few people actually get to the hospital. Delay is the most important, it's the biggest reason. And we have actually data from DC hospitals that show that only 30% of people with stroke symptoms actually present within 4.5 hours of their symptoms starting. So most people, like 70% of people, are waiting at least more than 4 hours before they actually arrive to the hospital. And again, the delay could be, hey, they're driving to the hospital or they're taking their nap or finishing off their dinner
yeah,
because they don't realize the urgency of the symptoms. But the problem is that the treatments that we have today, that's not a problem. That's the big thing, that we have powerful treatments today, including medications and procedures. But the timing for that is critical because we can only treat you within a certain time frame. And the more time we lose waiting on or delaying the stroke care, the more time we lose brain, basically.
right. And what are some of the biggest risk factors for stroke that people can actually control, Dr. Smoney? I know you talked a little bit about high blood pressure, diabetes, but so what are some of those risk factors that people can control? And going along with that, what's one question you wish patients would ask their doctor about stroke risk?
Yeah, so I think, as I mentioned, most of the risk factors are very common, right? High blood pressure, diabetes, high cholesterol, smoking, and
Mhm.
heart rhythm problems, which are oftentimes not under our control. But the blood pressure, diabetes, cholesterol, smoking are all modifiable causes, right? So, blood pressure, if you make sure that you are following up with your primary care and making sure you're on the right medicines, your blood pressure is being checked regularly, then that is something controllable. Similar to diabetes, similar to high cholesterol. Smoking, again, is under our control. I know easier said than done, but that is again something that contributes or has a very high likelihood of having strokes if you are a smoker. And then the heart rhythm problems are also something that might not be under your control, but notice the symptoms if you have any and ask your primary care about it, right? So if you do notice that your heart oftentimes flutters, especially when you're exercising, it has some irregular beats or something like that, I would just talk to your primary care about it. Ask them questions about stroke. Ask them questions about all these risk factors because again, these are mostly modifiable. So you can control them with the help of your primary care physician. All this can be controlled. And the last question you asked about, like, what is something that you should ask your physician? I think if you have a family member or if you're listening to this Facebook Live and now you know more about stroke, just ask your physician what can be done or what you can do to prevent it. And there are so many things that you can do to reduce the risk factors, right? So the AHA has always recommended exercising. We know that 150 minutes a week is something that is recommended. We think about it, we think that, oh, our lifestyle is active enough and that's why we don't need this 150 minutes per week. An active lifestyle is different, but having actually exercising for 150 minutes. It could be a walk around the block. Walking is underestimated, I always say. It could be a walk around the block, but contribute that to the 150 minutes per week. That is the one thing that can reduce your risk. Making sure, as I said, that you have regular PCP appointments to make sure all your risk factors are under control. And the third thing is dietary changes, right? So, what the AHA has recommended always is a Mediterranean diet for stroke prevention and for stroke symptoms and for stroke patients, basically. And this diet basically includes a lot of green leafy vegetables, colorful fruits and vegetables, nuts, less meat, no red meat actually. So no goat, no beef, no pork, or limited use of those, and focusing more on lean meat, which is chicken, turkey, and fish. That is what a Mediterranean diet comprises of. And if we focus on that too in our daily lifestyle, that will further reduce our risk of stroke.
Yeah. Going along with risk factors, does stress increase the risk of stroke? I feel like that's something I've heard, and I don't know if that's true or not. Can you clear that up for me?
Yeah, this is one of the most common questions asked by patients. And I think it's very important. So, stress alone does not cause a stroke.
Okay.
But think about it in this way: stress or depression can lead to other unhealthy habits, right? So when you're stressed out, you probably don't want to cook, you probably want to eat out, you probably don't feel like exercising, you probably feel like having a sedentary lifestyle is the best thing, you probably just want to sit on your couch and watch television. So all these stressors itself can lead to unhealthy daily lifestyle that can further exacerbate or increase your risk of stroke. Directly, stress is cannot be the sole factor to cause stroke, but yes, it can cause all these unhealthy lifestyle changes that can then lead to stroke.
Okay, that makes a lot of sense. Thank you for clearing that up for me. And what can viewers do today to lower their stroke risk? I know you talked about the Mediterranean diet. You just talked about a couple, prevention, talking about walking and all that. Is there anything else to
Yeah, I think
add?
yeah, most of it would be, exercising, making sure your risk factors are controlled, dietary changes, and being just socially also active. So attending this is also being socially active, or going out and talking to your friends and moving around. This all actually also helps with the happy hormones in our brain, and keeps it active. It and we talk, this is not about dementia, but we talk a lot about dementia, and that can be an effect, an after effect of of stroke. And for dementia also, we always say be having social activism or being socially active is just so important. So I would say that is another thing that can further reduce your risk of any sort of health conditions, but mostly brain conditions, being socially active.
Okay. And going back again to risk factors, if somebody in your family has had a stroke before, does that make you at a higher risk of having one? Is it any sort of hereditary factor or no?
Absolutely. So I think strokes in the young is usually associated with having, a background or having a family background of strokes in the young is something concerning. But think about all the risk factors that we talked about: the blood pressure, the diabetes, the cholesterol. That is something that runs in families, right? So if mom or dad or grandparents had these risk factors, then you are more at risk of developing these risk factors. And with our lifestyle that is nowadays more sedentary, eating more highly processed foods, these we are seeing more in young patients. And on top of that, you have the family or hereditary component that contributes to it. So we are seeing these risk factors more in young people. And that overall picture can actually increase your risk of stroke at an earlier age than what your parents or grandparents had.
Okay. Are there any health screenings that people could get to, prevent stroke or kind of monitor it, or would it be monitoring those things like blood pressure and your lifestyle and that sort of thing?
Yeah, mostly that. There are no health screenings. That, stroke is something that happens just so suddenly, out of nowhere. So there's no way to predict it, unless, of course, you have uncontrolled risk factors. Then your doctor should be talking about knowing the stroke signs and warnings. But even despite knowing all that, there's no way to predict a stroke happening. So yes, there's no screening for it per se. But your yearly or annual healthcare checkups with your primary care physicians are the ones that will give you a clue. Uncontrolled blood pressure, uncontrolled diabetes, that should all give you insight that, hey, something in my body might be brewing, or I need to make sure that these factors are well controlled so that something further bad does not happen.
Yeah. And I'll end with this. What do each of you want to make sure people take away from this discussion? I'll start with you, Alan.
Well, that they understand that strokes are a medical emergency, and
Mhm.
the only thing to do is call 911. There's no other thing to consider. Don't go to your doctor. Don't drive any place. Don't take aspirin. Nothing like that. Right? Sometimes people think take aspirin, which is actually could make it even worse. There's
Mhm.
nothing. Just call 911. That's it. And that you memorize the signs, the BEFAST signs, right? Balance, eyes, face, arms, speech, and T for time. And that you educate the people around you. You understand that we all look out for each other, that you often can't call 911 when you're having a stroke, where you can't even
Right.
speak. So it's in your best interest that you teach others. And maybe the way I'll close it is, it's probably the easiest thing you can teach someone that can make the biggest difference in their life, right? BEFAST is not calculus. It's a pretty simple thing. You learn that and you can save lives.
Yeah, I love that. Dr. Samani?
Yeah, probably adding to what Alan said, it is an emergency, but also remembering that it is also treatable. So we have made incredible advances in stroke care. We have treatments that can restore blood flow to the brain and significantly improve outcomes. But those treatments are all time sensitive. So when we say time is brain, we mean it literally. During an untreated stroke, the brain is losing approximately 1.9 million neurons every minute. That's about 30,000 neurons every second. So the longer blood flow is blocked, the more brain tissue is at risk. So the sooner someone gets medical attention, the more brain we are able to save. And I also want people to remember that stroke is not something that only happens to someone else. It can affect our parents, our grandparents, our friends, our coworkers, and sometimes even younger people, like we discussed. So know the warning signs, remember, BEFAST. Don't wait to see if it gets better. Don't try to take a nap. Don't try to complete that dinner. Don't try to drive yourself. And don't wait for a clinic appointment. Just call 911.
Yeah, great. Those are both great points to end on. And that ends our discussion for today. Thank you both so much again for joining us and talking about this important topic. We hope today's conversation has helped you understand the signs and symptoms of stroke, why every minute matters, and what to do if you think someone may be having a stroke, which is call 911 right away. So thank you again for joining us, and thank you, Dr. Samani and Alan, for answering our questions and taking time out of your day to educate us on this important topic. We'll see you next time.
Thank you. Bye.